his enthusiasm when it comes to exercise. I mean, from listening to Steve, you think you're going to get out there tomorrow, those of us who are not exercising on a daily basis. He spoke about waiting for a crisis in terms of exercising. And that happens to the most of us. But as he said, you don't have to wait for that crisis. However, some of us are challenged when it comes to consistency. And I trust that Carmita's presentation will touch on that. Carmita is going to look at the steps to behavioral change. And we want to listen to her presentation, and then we will have all the presenters back, and you will be able to ask your questions. So have your questions ready as Sister Carmita comes to look at the steps to behavioral change.
Good evening, church. All right, I'm going to continue in the same vein, looking at behavioral change. We're just trying to get the slides up. I'm sorry that so many of you missed Thursday night. We had a very good session at the Valley Resource Center. We had some visitors with us, and we looked at different aspects. And on one, I actually looked at a few of the behavioral change models to help us and to assist us. Now, I'm going to be on the same path, but slightly changing it. And I want us to look at some of the steps. We would have covered some of the areas that Brother Saul mentioned. He looked at attitudes towards behaviors. He looked at crisis. And Brother Steve also looked at trying to change behavior in a crisis. I know I have a neighbor who walks every single morning and sometimes on evenings. And do you know why he's walking so often? Anybody can hazard a guess? Heart attack. He had a triple bypass. And therefore, the doctor told him he has to exercise. And from then until now, which is probably about a couple years now, he has not missed a day in exercising. He exercised every day. We had another neighbor right opposite our house, and my husband would constantly talk to him about changing his diet. And he would keep saying, "You think I want the doctor to eat all the meat and get all the sweet food?" So he's not going to change his diet. And then he had a mild heart attack. He went to the hospital, and the doctors told him, "You have to start walking." So you know what he would do? Every night, about 8 o'clock, he was like Nicodemus. Nobody can see him walking. He would make sure he go late at night where he think nobody would see him, and he would walk. But unfortunately, it was a bit too late. One Sabbath, I was getting ready for church, and his wife came rushing out in tears, crying. And then I called Elliot to come from at church to come down to see him. But by the time he got there, he was pronounced dead. And that was the end of him. But he started walking like 6 months before he actually died of a massive heart attack. All right, so what I'm saying to you is try to let us look at these steps and make the change early. Don't wait until it's too late. All right, as Sister Roslyn mentioned, we need to look from way back at the prenatal. We're already born. Some of us are children. Some of you, rather, children. You need to start looking at changing your lifestyle from as early as childhood. All right, don't think that because I am 8 years old, I can eat as I like, and it makes no difference. You need to make sure that you eat a healthy diet and that you're getting your exercise rather than being on the computer all the time. Then as you reach youth, we have a lot of youth downstairs. they don't even want to hear about the behavior change. They prefer to sit down and have their own little discussion. I encourage them to come upstairs and hear and see what's going on, but it makes no difference. Now, how are you going to change your behavior from sitting down in groups while church is going on upstairs? This is about behavior change too. You know, one of the first things you have to do? Change that clique that you're associating with. That's the very first thing that you have to do. And we're going to see that coming out here as we look at behavior change. All right, I can change the slide. Expected to be big. But really and truly, it is because your entire family have a poor diet and the type of lifestyle which is inactive. And right now, we not only need to talk about exercise, but we have to speak about inactivity. All right? So it's not just going out and exercising on mornings. It is keeping active all day long. Now, before, when I look back at a lot of our pictures, I'm sure that you can agree with me. If you look through your album and you look at pictures back in the 80s and the early 90s and the 70s, everybody looked so skinny. Isn't that true? I don't know, but when I look through my album, every single person in my album tend to be looking really slim. But when you look through now, even at young people now, you can see a difference in the size. But then it was a lot of activity. Nobody was sitting down every day on the internet. They were going outside on the pasture and running around and playing. All right? People, if they were driving, they would still park sometimes and walk places. Now you're making sure you get the park closest to where you're going. You don't even want to walk 10 feet, okay? Or go through the drive-through, right? You don't park and walk in anymore. So all of these things make a difference. Now, why is behavior change important? A lot of times people say, I'm happy the way I am. But it is important. Behavior is what determines our health. To improve our health, we need to change our health behavior. So if we want to change behavior, there's some steps that we need to take. And the first step in behavior change is understanding what leads to that behavior. Now, if you're doing something, you need to understand, why am I doing what I'm doing? Okay? If you're sitting down at the computer every day, young people, summertime coming up, no school, what's the first thing you do on mornings? Are you going to go on the computer and play a game? Are you going to play the game for hours? Huh? Oh, and they play on the phone, on your cell phone. So why are you doing this? You need to understand, why am I doing the behavior that I am doing? If you're drinking alcohol, why am I drinking alcohol? Is it just to be a man? Is it just to associate with my friends because they're doing it, I am doing it too? Okay, and let's come home. Why am I sitting down outside when service is going on inside of the church? Because we're having such a good conversation and nobody from the group is strong enough to get up and say, let us go upstairs? Why are we doing this? So that's the first step to behavior change, is understanding what leads to the behavior that you're doing. Now, things that cause behavior are called determinants. What are they called? Determinants. And there are a number of different types of determinants, but to change your behavior, we have to address those determinants. And Brother Saul mentioned those determinants. But I am going to look at them in 4 different areas. The first one is called personal factors. And when we look at personal factors, it's like knowledge. What do you know about getting a heart attack? If you have enough knowledge that you know, if I eat fried foods, if I eat fatty stuff, if I don't exercise, there's a possibility that I might get a heart attack. Then you have some knowledge. So first of all, you have the knowledge. So if you want to act on the knowledge, at least you have the knowledge. Now, Brother Steve, he has knowledge that he has a family history or hereditary tendency, okay, of getting hypertension, or what we call high blood pressure. Now, if you have that knowledge, are you going to sit down on that and do nothing about it? If you do nothing, you will get it just like everybody else. But if you know that you are at a higher risk of contracting hypertension, then you have to work doubly hard as an individual to avoid it. So that's what we talk about, having the knowledge. And then there is the belief. A lot of young people believe I can have sex, unprotected sex, and I can get HIV, I can get an STI. But they can very much get an STI, and they can very much get HIV if they have unprotected sex. But they feel because I am young, I am invincible. Can't happen to me. So this is the belief. All right? And then there are the attitudes. All of this is still personal. What is my attitude towards something? I ain't like that vegetarian diet. Y'all can go and eat all this angel food. I want real food. I want meat. Right? That's the type of thing. That's your attitude towards it. Doesn't matter what happened to you. That is your attitude. So these are the personal factors. So you have to address these personal factors. You have to have the knowledge, you have to have the right attitude, and you have to have the correct beliefs. Okay, that's just to give you 3 examples. Then there are interpersonal factors. And let me come back to my example downstairs. We are 6 young people sitting around. They're all friends. They're all enjoying each other's company. Now, it is because we are affecting each other that we want to remain together. So nobody is strong enough to break the link and say, fellas, let me go upstairs, church starting. No, it's because you're doing it, I can do it too, and I can do it too, and nobody's strong enough. So that is what we talk about, interpersonal factors. So if you have a group in your class at school or a group in your workplace, and they decide we're doing a particular habit and nobody wants to break it, everybody goes along, everybody does it. All right? So you have to be strong enough to break away from that and make the change, and you might influence others to make that change too. So that's what we call interpersonal factors. Then there are environmental factors. These factors are really the circumstances that make it easier or difficult for you to do a particular action. Now, if you live, let's say, you live close to the beach, and you decide, okay, I'm going to get up on mornings and go and walk on the beach and exercise at the beach. This, we would say, is providing an avenue for you. You don't have to pay any money. It is free. It is there. It is close by. All right? So that is what we call an environmental factor that allows you to make that change and do what you want to do. Okay? If you say you want to go in the gym, you want to do some strengthening, and the gym offers you a reduced price, that is helping you. That's an environmental factor. I don't have to pay as much. I'm paying less. So you're making it available to me. So all of those are environmental factors. And the last factor is what we call policy or regulation. Now, a lot of people stop smoking or reduce the amount of cigarettes they smoke because of regulation. Now, Barbados have laws where you can't smoke in certain public spaces. So therefore, don't care how much you want to smoke. If you're in these places, you cannot smoke because you would get charged. There are laws. So therefore, for that period of time, you can't smoke. If you go on an airplane and you're traveling 5 hours, what are you going to do? You cannot smoke on the airplane. So therefore, for that period of time, there is no smoking. All right? So even though you haven't changed your behavior totally, a change has been made there. And then take, for instance, the seatbelt law. All of us that drive or that are driven in a front seat, at least, know that the minute you get in that vehicle, you have to buckle up. All right? Now, if that law was not passed, how many persons would actually be wearing seatbelts to protect themselves? Very, very few. Before the law was passed, I never used to wear a seatbelt, really. But now, because there's a law, automatically I put on my seatbelt and I wear it. All right? So that change was made for me, but I had to make that change. So that was still a behavior change. So there's certain policies and regulations that encourage us to make those changes. All right, when we look at risk factors, there are a number of risk factors. And there are some risk factors that are irreversible and some that are reversible. Take, for instance, if we look at the left, right here, can you see this? Right, these are genes that we are born with. So that is what we refer to as the hereditary tendency. Now, this is age. You can't stop yourself from aging. So these are two of the irreversible risk factors that you can't do anything about. But there are only a few that you can't do anything about. So if you're born with a gene, let's say for sickle cell or a gene, there are cancer genes now. I don't know if you're aware of it. There's a gene for breast cancer, and it runs in my family. My cousin that died, she had the gene. Her sister went and got tested, and she had the gene, and now she has breast cancer. And her daughter has the gene. So it is up to her to change her lifestyle now to avoid getting breast cancer. Because you have the gene, that doesn't mean that you will get the disease, but it means that you have a greater tendency to get the disease. So you have to do something about it. And then there are what we call controllable risk factors. Hypertension. Now, how are you going to reduce your blood pressure? Exercise. I'm sure Brother Steve mentioned that. Reduction of salt. If you reduce the amount of salt that you're taking into your body, then your pressure would come down. If you exercise, then you will lower your pressure. If you eat vegetables, especially the green leafy vegetables, then you would also reduce your blood pressure. So it's up to you. Your diet, your exercise, your activity can make a difference. So we see here activity. Here, no smoking. If you smoke, then you push it up. Here, reduction of weight. So this is a treadmill, but you don't necessarily have to use a treadmill. All you have to do is exercise. Diabetes. You don't have to have diabetes because your relative had diabetes. My mom, she died of complications of diabetes. I have a family history. My grandmother, before that, everybody in my family had diabetes. And I say to myself, I will not get diabetes. All right? So you have to work towards it by making sure that you exercise and you eat properly to avoid getting diabetes. So because you have a family history doesn't mean that you have to have it. You can work on it. You can control it. So we see here the obesity, the inactive lifestyle, smoking, and then up here, diet. LDL, low-density lipoprotein, and HDL, high-density lipoprotein, which is the good one. But when we do your cholesterol, if you come tomorrow and you get your cholesterol done, then that is an indication that you need to eat better. Even though you think you might have a family history of high cholesterol, your diet is what would make the difference. So you can change your diet in order to reduce the cholesterol, okay? So all of those are risk factors that we have to avoid. And health behavior. Now, changing behavior is not easy. It's not at all easy. Sometimes we figure, I want to make a change, but I don't know how to change. And especially when we look at a vegetarian diet, Sister Carissa, she interviewed a few young people for the Health magazine, and we're going to give you the Health magazines tomorrow. Even church members can get copies of it. It's not just for visitors, it's for everybody. But the interview that she did, when she interviewed a few of the young people, some say, I don't care to change my behavior. I like meat. Meat too sweet. I ain't changing it. And then some said, yes, I want to change my behavior. I want to be a vegetarian, but it's very difficult. I started and I stopped, and then I started back. So you find a lot of times people are kind of seesawing when it comes to behavior change. And therefore, they need to understand how to change the behavior. It's difficult. You can't do it all at once sometimes. But step by step, you can do it. And it's a process. But you have to make the plan. Now, one model that you can look at is what we call the health belief model. The first step is to recognize the risks that you have. And you find a lot of people follow this model when they're in crisis. And when you're diagnosed of cancer, you're diagnosed of high cholesterol, you're diagnosed of hypertension, then you find yourself in a crisis and you decide, okay, I must change my behavior. So when we look at it, it is all about perceived susceptibility to the problem. Do I have a problem with overweight? A lot of people will tell you, I'm all right, my weight okay. But this time they might be 20, 30, 40 pounds overweight. But they figure they're okay. So they don't perceive that there's a problem. It's only when you perceive that you have a problem, then you will do something about it. And Brother Saul explained this carefully. You have to know that you have a problem to make the change. Then you have to perceive the seriousness of the consequences of the problem. If you're overweight, do you know it will lead to cancer? Do you know it will lead to a heart attack? Do you know it will lead to hypertension? So you have to understand that if the problem is serious and it's going to be consequences, then I must make the change. All right? And then you have to perceive the benefits of the specific action. Brother Steve spoke about exercise. If you exercise, is this going to reduce my weight and then prevent me from getting a heart attack? So you have to see the benefits of exercise for you to go and exercise. Okay? And the last one, the perceived barriers to taking the action. I don't feel like getting up so early. I want to go to sleep late. All right? You need to deal with that. If you know you can't wake up on mornings, set your alarm and wake up. Go and exercise. What is the other barrier? If your ankle's going to hurt, then you got to work on that. You got to anoint them up. You got to wear ankle guards. You got to wear your knee guard. You got to do something. All right? So don't just allow the barriers. Oh, I want somebody to go with me. Then you make sure you get a friend and you have somebody to go with you. So you don't allow the barriers. Any barrier that you see, you have to deal with the barrier. So we have the perceived threat and then the outcome. So the outcome must be of benefit to you. So what are your expected outcomes? That you would not get diabetes, that you would not get hypertension, you would not get cancer, you would not get heart disease, and you would have a healthy body to work for the Lord, right? And to work, make money, do everything. But you would be healthy, you would not be sick in bed. So you have to see these outcomes or expectations. And self-efficacy is a very important part, and I need you to focus on this. Self-efficacy is the perceived ability to carry out the recommended action. Now, if you don't think that you can do it, then you wouldn't even try. All right? Now, Brother Steve, he gives a personal testimony, and he said he did not think that he could walk up the hill or he could ride up there. But he had a higher goal. He keeps saying, it's like the kingdom. I got to get there, I got to get there. So you have to set goals for yourself too. But most important, you have to have that self-efficacy to know that through the grace of God, you can do it. And that's important. All right, we're coming to the end. So there are some strategies for managing health behavior. And let's go through the strategies. The first one is to pray for guidance and direction and keep trusting. Now, I don't know about you, but I don't do anything except I pray. Because within myself, I can always relapse. I can always fall by the wayside. But as long as I have that strength, I know I can continue to the end. So that's the first step. Then you have to identify the behavior that you want to change. And then we spoke about determinants. You have to identify those determinants. And then the barriers. What are the barriers to prevent me from exercising? What is preventing you from going into the gym? I don't have any time, right? I don't have any, well, some people might say distance. Yeah? So it doesn't have to be the gym. What prevents you from exercising? Sister Flo shared with me that she teaches at a primary school, and what she does is take her clothes to work, and she exercises around the playing field, the same school. So she doesn't have to worry about time. She's right there, and she's also encouraging other teachers to come and do the same thing. So she's an influence to others. So you have to see what is preventing you, what are your barriers, and you break the barriers. You don't need to travel from St. Philip down to St. Michael if you know that that distance is a problem. You find some area around St. Philip where you can exercise, okay? And then you take steps to remove or reduce the barriers, and you plan to change. Now, if you don't plan to change, you will never change. So you have to make that plan. And then you have to involve some significant others in the plan. Now, if you have a family, you involve your family. If you have a spouse, you involve your spouse. If you have some girlfriend or boyfriend spending time together, you involve that person, and you find that the activity, whether it is a vegetarian diet, whether it's exercise, whatever activity is going to be much easier when you're involving your significant others. And then you recognize that change takes time. Some people put on weight very quickly and they expect to lose it in 2 days. Can't work. If you put on 20 pounds, how long is it going to take you to lose it? It might take you 3 months, 4 months, 5 months, an entire year. But the important thing is that each day you're doing something towards losing that weight, okay? And then managing behavior change is critical for lasting, because a lot of people start to make the change and then they relapse. So they decide, let's say, for instance, you decide every day I'm going to read 2 chapters from the Bible. You start January, you go through, and every day you read 2 chapters for January. By the time you get into February, you realize, oh, I got to get up earlier today, I got to do something, I got to do this, and then you stop. All right? But you can't afford to relapse. When you start something, you need to see it right through. So these are the stages of change. And I just want to look at the vegetarian diet, young people, church members who are not yet vegetarians. As Sister Carissa asked some of the young people, they said, we are not vegetarians. Now, you're hearing the health message. So we're reaching what we call the contemplation stage, which is the second stage you're seeing there. And we decide, okay, we've been hearing this health message. I want to be healthy. By the time I reach 40, like Brother Steve, I don't want hypertension. Or by the time I reach a certain age, I don't want to get cancer, whatever. All right? So you're starting to think about it. I'm going to change. All right? Now the next stage is preparation. What are you going to do to change from being a meat eater to being a vegetarian? First of all, if you're a young person, you have to discuss it with your family. And I'll give you a personal testimony. I became a vegetarian in 1977. At that time, I was a young person living at home with my family who were not vegetarians. I went to camp in Dominica. I heard the health message, and I was convinced that this was the diet that I wanted to eat, and I will be a vegetarian. So you know what I did? I came back from camp, I came home, and I made up my mind I will be a vegetarian. They were still cooking meat in my house. So you know what I did? What do you think I did? Huh? Oh, no. It took some time before I married a vegetarian. But no, I didn't eat the meat. I would take the rice, and I would eat the rice, and I would cook some little lentils on the side, and I would have my rice, and I would have my lentils. When they cooked soup, I would tell them, please, if y'all don't mind, cut the meat separate so I could get some of the soup without the meat. And they would oblige me, and they would do that. But they never went out and bought vegetarian products for me and stuff like that. I had to make do with what was there, leaving out all the meat. At school, that was the most difficult part of it. When you go to school, you go in the canteen, you can't find a lot to eat. And I wasn't packing lunch and carrying to school, so I would have to eat if they had bread and cheese or whatever, but I was not eating the meat because I was convinced I will be a vegetarian. All right? And then you would have your friends coming and putting the chicken in your face and your family and say, smell it, tastes good, nah? And then at Christmas time, that was the worst time. Because then in the house, they would have the ham, and they would have the turkey, and they would have chicken and everything. And if you wanted to be a vegetarian, you couldn't partake of any of those things. But to be honest with you, I never once relapsed. I continued from 1977 until today. Throughout my pregnancies, I continued to be a vegetarian. I never changed my diet. All right? So that is the type of willpower that you have to have. But in terms of preparation, you have to be prepared that whatever barriers come, you will jump over them. Whatever hurdles come, you will deal with it. If you can't purchase stuff, you would make sure that you only eat what is vegetarian. But now, as adults, when you reach the stage that you can purchase stuff, then your choices in the supermarket would make the difference in being a vegetarian. So now you can start to look at, okay, what am I going to purchase that can make a wholesome diet that I would not miss meat and I would still have the protein that I need. Okay, so that is important for preparation. And action is when you do the thing. So you prepare, and then if you want to be a vegetarian, you make sure that you're doing all the things you're eating and you're exercising. So it's not just being vegetarian, but it's a total package of health reform. And lastly is maintenance. You want to maintain the diet. You know, that camp that I went to, when we left camp, I don't know if Brother Austin went to that camp as well, I think so, in Dominica. Every single person that left that camp was vegetarian because the message was so gripping and forceful, and we were so convinced. And some people lasted a year, some people lasted 5 years, and some people lasted right through until today. All right? So you have to maintain the particular diet, and the message that you've heard have to be constantly before you. So the knowledge, the attitude, the information, that's important. I remember I said, if we work together as a family, we eat together as a family, it will make a difference. Exercise, we see Brother Janison there doing some strenuous exercise. And it says exercise and losing weight will make your heart pump just great. All right, so we have to keep the healthy food and the exercise up and lose the weight. And most importantly is keep connected to God. Anytime you think that something's too difficult, who should we turn to? We should turn to God, Jesus. Because whenever we think that we will relapse, that's the time you get down and you kneel down and you pray and you ask for help. There's some other difficult, it might not just be diet. There are some persons who decided to stop drinking alcohol. Right? Some people might have started and decide to stop. And then the temptation is there, it is greatest. That's the time that you need to kneel down and pray most to kick the habit. So if you're talking to people and you want to give them advice, this is some of the advice that you have to give them. We had probably 1 or 2 young people that would have passed through our church who used marijuana, who started using marijuana and got hooked on drugs. So if you want to pull some person like that back into the church, these are some of the steps that you also have to deal with. As long as they go clean, then to maintain that is going to be difficult. So you have to point them to Christ, and that is the important thing. All right? So remember, keep trusting in God, and there's nothing too difficult for you to change. Anything that you want to change, you can change once you trust in God. Thank you very much.
We want to thank Sister Carmita for that very explanatory expose of behavioral change. Indeed, we have learned many things here this evening, and I know that you have questions you want answered. However, I think the answers to all our questions, we already know the answers. Anyhow, if there is anything that you want to discuss, the panel will be back here, and we want you to get your questions ready. So we're going to ask Elder Leacock, Steve Codrington. Sister Carmita is already in position. And a few things that I have learned is that behavior is dictated not only by behavior is dictated by culture, is dictated by our society, is dictated by our values, our morals, our ethics, and our genetics. Sometimes we think that is only the genetics that play a part, but we realize that we have all of these outside forces. And Sister Carmita touched on a very important aspect, where the aspect of coercion, where we would see behaviors being displayed not only by young people, but like other persons. But if you are in the right environment, if you are in the right group, you can serve to encourage one another and coerce that person to do the right thing. So we realize that it is not just one aspect or one element, but it is an overall type of change that we need to take place in our lives. So we have our panel here. The first question, and we would ask you to go to the mic